So VBAC is vaginal birth after cesarean delivery. So many women have cesarean deliveries for several complications during labor or before labor. It might be from the mother's side, it might be from the baby's side. But when they are pregnant next time, it doesn't mean that they have to have a cesarean delivery again. So many women, most of them, 90%, can have a vaginal birth after a previous cesarean delivery. The reasons why they had cesarean delivery before in the previous pregnancy are not always recurrent indications. Those complications are not always repetitive. So these women, even after having a cesarean delivery before, can have a vaginal birth in their next pregnancies. So there are certain criteria as to whether they are eligible to have a VBAC or not will be decided by a gynecologist. So it depends on the baby's weight towards the end of your pregnancy. It depends whether you are in a natural labor pains or whether you need labor pains induced, because with induction of labor pains there might be some complications expected. So if you have an average sized baby and if you get pains naturally, you should be able to go for a vaginal delivery in most scenarios. But sometimes many people will even need induction of labor. So in such situations, the complication we expect is something called as rupture of the uterine scar. That is, you have a cesarean scar on your uterus, which means that you've had sutures put. So sometimes during the pressure of that baby's head down below, your previous scar might give away. There might be internal bleeding. Sometimes your baby's heart rate patterns might vary. These are the complications that we expect. But like I said, 90% of women can deliver normally, that is vaginally, after they've had one previous cesarean. But if women have had 2 cesareans before or more than 2 cesareans before, then the situation is different. The rate of complications is higher and we don't usually prefer for normal vaginal delivery for them. But again, each individual patient is different, each individual case is different. We will make our decision based on an individualized approach. So if you've had one previous cesarean, you can still have a vaginal delivery, and please ask your gynecologist the same.